If you're taking dopamine agonist medications for restless legs, pramipexole, ropinirole, reticotine, or others, you need to know about impulse control disorders. These are serious side effects that can develop even years after starting the medication, and they often develop so gradually that you don't realize what's happening. I'm Mark Chapman. I've been on ropinirole for 6 years, and today I'm explaining what impulse control disorders are, how to recognize them, and why this matters even if you're not experiencing the classic symptoms. So firstly, what are impulse control disorders? Well, these are compulsive behaviors that dopamine agonist medications, your RLS medication, can trigger. The most well-known are pathological gambling, compulsive shopping, hypersexuality, and binge eating. Research shows that 20 to 40% of people on these medications develop some form of ICD. That's 1 in 3 to 1 in 5 patients. Now, these aren't personality flaws. These are medication side effects caused by how dopamine agonists affect your brain's reward pathways. And this might explain why you do some of the things that you do in your life. Now, dopamine agonists work by stimulating dopamine receptors in your brain. That helps with RLS symptoms, but dopamine is also involved in reward, motivation, and impulse control. When you overstimulate certain dopamine pathways, you can develop compulsive behaviors around activities that trigger dopamine release: gambling, shopping, eating, or sex. The dangerous part, ICDs often develop gradually. You don't wake up one day gambling away your savings. It starts small, a little more online shopping than usual, spending more time on hobbies or an increased focus on certain activities, and then it escalates. Pathological gambling is the most studied. So people who never gambled before suddenly can't stop. Online gambling, casinos, lottery tickets, they lose thousands, sometimes tens of thousands of dollars. Compulsive shopping, buying things that you don't need, you can't afford, or you won't use. Credit card debt piling up. Hypersexuality, increased sex drive, compulsive pornography use, inappropriate sexual behavior where there was none of these things before. These are all signs. Binge eating is another, eating large amounts of food, especially when not hungry, especially carbohydrates and sweets. Now, these are dramatic presentations, but there are subtler forms. Here's my experience. I don't have gambling problems, shopping addiction, or hypersexuality, but I do see patterns. I have a strong tendency to get distracted, working on one task, then getting pulled to another, then another. This happens at work and in personal activities. I can focus well, but I seem to skip between tasks too easily. I also have obsessive hobbies, motorcycles. I'm constantly trying to improve technique. I do track days. I'm trying to go faster. I'm endlessly watching videos about technique improvement. It's a relentless drive for improvement in that specific area. I'm never going to be a motorcycle racer, but I just have this need to keep pushing. Now that I know about it, I can control it a lot better, which is great because it's an expensive and sometimes dangerous hobby. Now, it's important to know about these things because impulse control disorders can destroy lives. People lose their savings to gambling, marriages end over compulsive behaviors, jobs are lost. But even the subtler forms matter. Changes in focus, increased compulsiveness, obsessive patterns. These affect your quality of life. And here's the critical part. Many people don't connect these behaviors to their medication. They think it's stress, personality changes, getting older, those sorts of things, but they don't realize their dopamine agonist is causing it. In addition, doctors often don't ask about ICDs. I've never been asked. And the burden is on you to recognize the symptoms and bring them up. If you're concerned about whether this is affecting you, here's some questions to ask. Have your spending habits changed since you started the medication? Are you shopping more, spending more impulsively? Have you started gambling or increased gambling behavior? Has your interest in sex or sexual content changed significantly? Or are you eating more compulsively, especially sweets or carbohydrates? Perhaps you've developed new obsessive hobbies or intensified existing ones. Now, if you're not sure, then ask your family. Often family members or partners notice before you do. They see the behavior changes. They might be seeing what you're missing. Okay, if you recognize ICD symptoms, talk to your doctor immediately. Treatment usually involves reducing the dopamine agonist dose or switching to a different medication class entirely. Alpha 2 delta ligands like gabapentin or pregabalin don't cause ICDs. However, never stop dopamine agonists suddenly. That requires medical supervision and a gradual tapering. The good news is ICDs typically resolve when you stop or reduce the medication and the behaviors aren't permanent, but you need to recognize them first. Now, if you're just starting a dopamine agonist or currently taking one, monitor yourself, track spending, notice hobby intensification, or pay attention to behavioral changes. Have honest conversations with family members. Ask them to tell you if they notice changes. And if you can, use the lowest effective dose. Higher doses increase ICD risk. Myself, I'm currently switching from ropinirole to gabapentin, partly because of augmentation, but also because I want to avoid worsening ICDs. The tasked switching and perfectionism are manageable now, but these medications can cause progressive changes. I don't want to find out years from now that the compulsiveness escalated into something more serious. Now, an important disclaimer, as always, I'm not a doctor. This is educational information based on research and my experience. It's not medical advice. If you're experiencing impulse control symptoms, talk to your healthcare provider and never stop or change medications without medical supervision. If this was helpful, please subscribe. I post twice weekly with honest information about RLS medication, side effects, and the things that doctors don't always discuss.